Carol Fox. I'm the Chief Medical Officer for Excela Health and a proud graduate of the Latrobe Hospital Family Medicine Residency Program. I've been in this area for over 30 years now, and I've spent my entire career associated with the Family Medicine Residency Program, and it's been an awesome experience. I started as a resident, and when I graduated, I became a member of the faculty before moving into the role of program director. I was initially the medical director at Latrobe Hospital and ultimately became the chief medical officer for the health system. And I still have the great pleasure of being associated very closely with the residency program. It gives me the opportunity to ensure that Excela and Latrobe Hospital remains very focused on education and learners. We are very proud to receive the Baldwin Award. The Baldwin Award really focuses on humanism in the learning environment. We were really honored for creating an environment that's very humanistic for those individuals. I think that the program provides opportunities for the learners to really focus on areas of family medicine that are of the most interest to them. I believe very strongly that residents who graduate from this program are very well prepared for the future. I'm happy to say that our graduates are very much sought after, not only here, but at other locations. So should you choose Latrobe, I can tell you without hesitancy that you will find yourself in a place where you're welcomed. It's a warm place. You'll feel like you're part of a family, and you will be extremely well trained and ready to face any challenge that comes your way.
I've been a faculty member since 2005 and a program director here since 2009. We were founded in 1974 as an unopposed program, and to this day we remain unopposed. We're the only family medicine residency not only in the hospital but in our entire health system. A lot of times applicants will ask, what's your biggest strength? And for me, that's always been pretty easy to answer. And I've always felt that the biggest strength of any organization ought to be its people, and it most certainly is here. We have a large family medicine faculty with over 200 years of combined experience, both clinically and educationally. When you look at the interests of our faculty and what we're able to teach our residents, we really do have all the bases covered, whether it's women's health, pediatrics, sports medicine, hospital medicine, point of care ultrasound, or addiction medicine. We really have all of family medicine covered really well. So another question that applicants will ask is, what are we looking for in an applicant? We want someone who's going to fit in with us, being hardworking, being humble, being willing to learn, being the type of person that if one of your fellow residents gets ill, that you would jump in right away and take their call. So just that fit is more important to us than board scores or grades or things of that sort. Another big strength of ours are our facilities. We have 2 new family medicine offices. We have what's called the on-stage, off-stage approach, where the patient goes right from the lobby into the exam room. From a team standpoint, our nurses, our secretaries, and our physicians are all huddled together at the same workstation, and that improves communication and ultimately patient care. We enjoy tremendous support both from administration and from our Charitable Foundation. Additionally, whenever we need something that might be over budget, they've always been there to help with educational support. I've done hundreds of applicant interviews over the years. With very few exceptions, all the applicants who have come through here have made note of how happy our residents are. Certainly not something you can fake, and I just think that just speaks to our atmosphere and environment and the support that they get.
Hi, my name is Sciullo, and I'm the current chief resident here at Excela Health Latrobe Family Medicine. This program fosters an excellent learning environment. The residents have a great relationship with each other as well as with their attending physicians. Some of the residents here have become some of my absolute best friends. And I'm so thankful to be around people each day that I enjoy working with and would also enjoy spending time with outside of work. I also appreciate that the physicians here have a strong bond with many of their patients and want each resident to learn to be caring and compassionate in addition to learning a strong medical knowledge base. Another perk of this program is the available resident housing. It's so beneficial to be able to live just across the street from the hospital. It's also really nice because we are able to take call from our houses, which especially on night float is really beneficial. Overall, if I had to do it all again, I would again choose Latrobe Family Medicine for my residency.
Hi, my name is Paul Ammett, and I am a pharmacy doctor on faculty with the Family Practice Residency Program. I've been involved with the program since 1990 when I finished my residency training through the Mercy Hospital of Pittsburgh, and I've been a faculty member since 1993. All the residents do a rotation with me. It's typically a 2-week clinical pharmacology rotation. My daily responsibilities include attending morning conference with the residents, and then we move to the ICU where we're part of the collaborative care team. And after finishing in the ICU, we'll move on and then work with the hospitalists and also with the family practice inpatient service, just managing their pharmacology questions. During the rotation, the residents are also assigned a drug for the day. And with that, it's just about a 5-minute presentation just to familiarize yourself with the medication and look at the mechanism of action, how it's dosed, side effects, when you'll see it begin to work, and most importantly, the role that you see for it in clinical practice. And then as you become a upper year and supervising resident, you'll have more understanding of the clinical area where that product should be used. A lot of the focus of the rotation is based around antibiotic stewardship, assuring we have the appropriate dosing. The goal is to have you feel very comfortable with the use of antibiotics and also with anticoagulation.
My name's Alex Fleming. I'm a resident at Latrobe Hospital. I'm from Murraysville, PA originally. I chose Latrobe and Excela for my residency just because I really felt like the attendings and everyone involved in the program was really invested in helping you become the best doctor you can be, whether that's in family medicine, geriatrics, sports medicine. They take all the steps possible to help you.
Hi, my name is Michele. I'm the Director of Behavioral Sciences here at Excela Health's Family Medicine Residency Program. Behavioral medicine is taught longitudinally throughout the 3 years that you are here. This includes teaching about psychopharmacology, in addition to ways to structure your patient interview. It's very important in family medicine to make sure that we establish positive and trusting relationships with our patients. We will teach you skills related to motivational interviewing and make sure that you are culturally competent upon completion of the program. In addition, we will teach you how to complete a thorough psychosocial history. This includes learning ways to identify a variety of mental health disorders and knowing which treatments work best for which disorders. One of the most important roles that I have here as a psychologist within this program is making sure our residents take good care of themselves. Obviously, we want you to work hard and maintain very high professional standards, but not at the cost of your family relationships and the relationships you have with significant others. Therefore, we talk a lot about ways to prevent burnout, not just during residency, but afterwards throughout the rest of your career. Latrobe provides a great location for this to occur. Not only do we have a lot of great activities within Westmoreland County, but there are many things for you and your family to do very close by. For example, within 25 miles east of here, there are 3 ski resorts and a variety of parks located in the Laurel Highlands for activities such as whitewater rafting, biking, and hiking. Similarly, it's about 35 miles to Pittsburgh, and so any of our residents who enjoy being in the city have easy access to all of the activities that Pittsburgh has to offer. In addition, it is a bonus having Steeler Training Camp located in Latrobe for any of our residents who have an interest in sports medicine. Although I completed my doctorate in counseling psychology in the city of Pittsburgh, I'm very happy that I made the decision to join the Latrobe Family Medicine team back in 2013.
Hi, I'm John Kopko. I grew up in Greensburg, Pennsylvania, and I chose Latrobe because it was a positive, encouraging learning environment with happy residents.
Hello, my name is Kevin Bartolomucci. I'm the Assistant Program Director, I have been in Latrobe now since 2012. I did my medical school training at Lake Erie College of Osteopathic Medicine and came back after medical school to do my residency here. I do a lot with our osteopathic curriculum. My whole goal is to really try to improve your competency with osteopathic manipulation. I always felt like coming out of medical school, you learn a ton of different treatments and don't necessarily know how to incorporate them. So I try to teach you a systematic approach to figuring out a treatment plan that you can replicate time after time with each patient. I also do have a passion in addiction medicine, and I've been trying to grow our capabilities of treating addiction within the office, both through the use of medicines such as Suboxone or Vivitrol, to help out this patient population. The thing I like most about Latrobe is the people that we work with. I think we have a very good group of faculty. I think the small hospital feel allows you to develop closer relationships with everyone in the hospital, not just the physicians that you work with. And it helps just breed a good working environment.
I decided to come to Latrobe Hospital after I met the director and a lot of the faculty and other residents in between my first and second year when I did the Bagby Scholarship. Everyone was just extremely nice and welcoming, and I just felt like it was more than just a residency program, but also everyone seemed to be like family. I just absolutely have been very happy with my decision. It's just been wonderful. So I have had a wonderful experience. I would highly recommend coming here to anybody.